The journey to value in our healthcare system has been protracted. The fact of the matter is that I think everyone 20 years ago would have expected we'd be farther on that road by now than we are. And that's not just a challenge to the businesses that are involved in healthcare. It's a challenge to patients because we could be driving better value, better outcomes than we are. And every year that's additional lives that are affected adversely. Realizing that AI and machine learning are going to accelerate our ability to understand what's happening with patients, our ability to predict what's happening with patients, our ability to consider all of the inputs that lead to health behavior choices and health outcomes. That is a set of concerns that Arcadia is very squarely positioned to address well. Each customer is at a certain point in a journey to transformation. And there is no point in that journey that's more or less exciting or interesting. On the one extreme, folks approach Arcadia for support with making sure they achieve quality gap closure and they attend to the right patients at the right time. And that's absolutely critical. The other extreme of our sort of customer VBC maturity spectrum, there are these organizations that have really been doing VBC for a long time, since before 2009, since before the ACA. And the fact that we now have a set of products that we can bring to those customers as well to take them to the next level is equally exciting. That is really like the frontier of where value-based transformation is. I think that Arcadia's value can be framed as who to reach out to, when to reach out to them, and how to reach out to them. So the who is the most developed, and I think that's the ongoing work around risk identification and appropriate capture of risk, not just in the ICD codified risk, but in the social domains as well. So measuring, recording, tracking health-related social needs is going to help us understand the who. The when is really, I think, where Arcadia is going to shine and does shine with timely data. Our ability to contextualize with sort of environmental or geographic comparators, and then use real-time data to know today's the day, actually, because we got this signal today, which you can only get through a close clinical connection and increasingly the ingestion of non-traditional health-related data. Today's the day that we should reach out to this patient, either because we see them starting to go down the road of decompensation, or because there's something else in their environment that makes today a day when they might be particularly receptive to a message. That's the Arcadia platform can take many different signals and translate them into healthcare responses, healthcare events, so that we're not stuck in this healthcare reactive moment that we have been in the past.